What are HIV and hepatitis C?
Many people have heard of HIV and know that they don't want to get it. But what is it?
HIV is a virus that weakens your immune system. With a weakened immune system, your body can't fight off infections. Your immune system can't get rid of HIV like it can other viruses, such as the ones that cause the common cold. HIV is a virus that can lead to AIDS.
You mean HIV and AIDS aren't the same thing?
No, HIV is a virus that attacks your immune system. AIDS is a disease that can happen in the late stage of HIV infection, when your immune system is really weak and your body can't fight off infections anymore.
Is there anything I can do to stay healthy if I'm HIV positive?
Yes, there are very effective medications for HIV called antiretroviral therapy, or ART, that can help control HIV in your body and keep your immune system strong. These medications can keep the amount of HIV in your body to very low levels and really help to improve your health.
Over 1 million people in the United States are infected with HIV, and about 1 in 5 people with HIV don't even know they're infected. If you have HIV, it's very important that you see a healthcare provider so you can be treated. It's crucial to your health.
And what about hepatitis C? I've heard of that too, but I don't really know much about it.
Hepatitis C, or Hep C, is a virus that infects the liver. Your liver is important because it cleans the toxins out of your blood. You can't live without a liver.
A lot of people have hepatitis C. It is 5 times more common than HIV. About 5 million people in the U.S. have Hep C, but approximately 1/2 or 1 in 2 people do not realize they are infected. That's a big deal.
If you have hepatitis C and you don't know it, you could develop liver damage, something called cirrhosis.
Cirrhosis?
Cirrhosis is permanent scarring of the liver, which can be caused by hepatitis C. Not everyone with hepatitis C will get cirrhosis, but doing things like drinking alcohol increase your chance of liver damage, especially if you have hepatitis C.
Hep C and drinking together, that's like a 1-2 punch to the liver.
If you have cirrhosis from Hep C, you're also at risk for getting liver cancer.
Treatment for hepatitis C can prevent damage to the liver and prevent liver cancer. There are new drugs being developed to treat hepatitis C all the time. More people are being cured and treatment is getting better and better.
So, let me make sure I'm clear on this. HIV is the virus that attacks your immune system, and HIV can lead to AIDS, but medications can control HIV and improve your health?
Yes, that's correct. And hepatitis C is the virus that infects your liver and can lead to cirrhosis. Drinking alcohol can increase the chance of cirrhosis. However, there is treatment that can prevent damage to the liver and liver cancer.
How do I know if I am at risk for HIV or hepatitis C?
HIV is spread by contact with blood, semen, vaginal fluid, breast milk, and other bodily fluids that have the HIV virus in them. HIV is most commonly spread by unprotected sex or by sharing needles.
Having unprotected sex and sharing needles is risky. Play it safe. Always wear a condom. Use new needles anytime you inject.
Hep C is also spread by exposure to infected blood. Like HIV, this can happen if you share needles. But not just needles. You can get Hep C and HIV by sharing works too. Syringes, cookers, cottons, and even rinse water can have small amounts of blood on them. So be sure to always use new works.
Even if you only injected once, long time ago. That may have been enough to get HIV or Hep C.
I've never injected drugs. Are there other ways you can get Hep C?
Yeah. Any contact with infected blood, even a tiny amount, can spread Hep C. You can get it by sharing straws for snorting, by sharing a crack pipe, or by getting a tattoo with a dirty needle. Also, don't share razors or toothbrushes with someone who has Hep C, because sometimes those things can get small amounts of blood on them.
You can also get Hep C from sex, but that's pretty rare. Hep C can be spread during sex if you're exposed to blood, which can happen during anal sex or rough sex.
You can't get either HIV or Hep C through casual contact. From things like hugging, kissing, shaking hands, or sharing food or eating utensils. Don't worry about that stuff.
HIV and Hep C can damage your health if you don't know you're infected, so it's really important to be tested for both. It is possible to have both HIV and Hep C at the same time.
How would I know if I'm infected with either HIV or hepatitis C?
I had no idea I was infected with Hep C. I felt fine, but my doctor asked if she could test me for HIV and hepatitis C because I told her I shot drugs when I was a kid.
You may not realize that you were infected with HIV or Hep C. These viruses don't always cause symptoms, especially early on. That's why it is important to get tested for both. You need to know your status.
Anyone who may have been exposed to HIV or hepatitis C should talk to their healthcare provider about getting tested. It's especially important that anyone born between 1945 and 1965 be tested for hepatitis C, because they may have been exposed to the virus before there was a good test for it.
How can I be tested for HIV and Hep C?
You need to get antibody tests. These tests check for antibodies which your body creates after being infected with HIV or Hep C. If either an HIV or Hep C antibody test is positive, you need to talk with a healthcare provider so you can have a second test to confirm the results of the first test.
Remember, if your antibody test is positive, it doesn't end there. You need to have a second test done, which is called a confirmatory test, to know for sure whether you have HIV or Hep C. Be sure to talk with your healthcare provider.
How can I get these tests so I know what's going on?
Both HIV and Hep C tests are blood tests that you can get at a clinic or doctor's office. There are also rapid tests available for both HIV and Hep C. With rapid tests, you can get the results in less than half an hour. Rapid tests use blood from your finger or fluid from your mouth.
Man, that is way better than having to go back and get your results on a different day. I definitely like the idea of getting my results right away.
Rapid HIV and rapid hepatitis C testing. How it works. I am really glad you are here today to get both the HIV and hepatitis C tests. We are going to use the rapid test today, so the results will be ready in about 20 minutes.
How do these tests work?
First, we clean your finger. Then we will prick it to get a drop of blood and put that in the test. If you are doing the test with oral fluid, you simply rub this paddle a couple of times across your gums to get oral fluid on the pad. We then drop the pad into the test. With both the blood and oral fluid rapid tests, results are available in 20 minutes. There are 3 possible results for a rapid test: negative, positive, and indeterminate. Negative means you don't have the antibodies and therefore were not infected with HIV or hepatitis C. Positive means you've been infected with either HIV or hepatitis C in the past, and you need a confirmatory test. If the results come back indeterminate, that means the test didn't work properly and we need to try again.
So what are my results?
Your rapid hepatitis C test is positive, but your HIV test is negative. This means that you may have hepatitis C, but we need to get the confirmatory test to know for sure. The negative HIV test means you do not have HIV. Remember, the antibody tests may not pick up very recent infections, such as within the past 3 months. So, if you may have been exposed recently, you will need to get checked again, and you should discuss with your healthcare provider.
All right, so what happens next?
Now we will draw some blood so we can run the hepatitis C confirmatory test. The test results won't be back for a couple of days, so we'll make an appointment for you to come back to get the results. Let's also talk about how you can stay HIV negative, and in case your hepatitis C confirmatory test comes back positive, what it means to have a hepatitis C infection and how you can prevent spreading it to others. Know your status.
Get tested for HIV and hepatitis C.
It's important to know your status.
If you're negative, stay negative.
If you're positive for HIV or Hep C, make sure you talk with your healthcare provider to find out how you can get treatment and learn how to prevent passing these infections on to someone else.